Hi, my name is Paula and today we're going to talk about addictions. Addiction is defined as not having control over doing, taking or using something. Also is defined as a chronic dysfunction on the brain that involves motivation, reward and memory. You could be addicted to just about anything, and when people experience addiction they can control the way they act or the way they react to a substance or a situation. Some of the symptoms of the addictions are not be able to stay away from the substance or the addictive behavior, lose self-control, and also have an increased desire for the substance or the addictive behavior. Some of the complications produced by addictions are, in a physical way, you could have damage and diseases like damage on your brain. In a psychological way, you can have diseases like anxiety and depression, and in a social way, people with addiction tend to have damaged relationships with their family and friends. Okay, so talking about the story of addictions, addictions have been around since the beginning of the civilization. Our ancestors liked the rotten fruits because it contained a lot of sugar that ferments into ethyl alcohol, developing addictions like alcoholic drinks and substances. In my opinion, addictions is a topic that involves so many things, and that there's a lot of addictions increasing like social media or work, and that we don't have enough knowledge about it, so we don't know how to get help in those cases. I think we need to have a better education for knowing what to do if we are passing for something like an addiction. That's what I think. Thank you.
Thanks, Paula, for your explanation. Now we are talking about the most common questions about this topic. For addictions or toxic substances, for example, alcoholism or drugs dependencies. There are multiple addictions too. For example, new technologies, sex, gambling, video game, mobile, shopping, and the others. One question can be, is preventive? The answer is yes. The addictions are very difficult, but they have a little more prevalence, but in more fact of risks, the risks that can be increasing your changes. For example, social factors, living in a very disadvantaged environment. Family factors, for example, local with your families, or in your family maybe can one person do drugs use. Individual factors, behavior problems, love of esteem, yes, school factors, for example. In the adolescents, this very important, the education and the early age, to try to education and avoid feelings with different addictions. The treatment for addictions, there are multiple addictions, for example, depending on the individual or the age patient. Among we find individual psychiatric treatment or individual and psychiatric therapy, or with groups or with your family couples. What specialized treat it? Addictions may be treated with a specialized in psychiatry. In my opinion, the addiction is a very chronic disease of the brain. It's based of search to tell throughout the consumption of the use substances and the other different behaviors. The development of this person and ability to control and dysfunctional emotional response. They create a life in addiction person, reduce the quality of life. Other pathologies, maybe anxiety, schizophrenia, or depression can be your result to become a worse problem. So if you need more information about this topic, this is disponible in the web, in the United States Association of Psychiatrists.